welcome back. So in the previous video of growth and development, we had to do the MCQ questions, which we will be doing now. The MCQ questions for the NEET pre-PG exams include the weight for age. So we have an MCQ at birth in India. The mean age for the baby is mean weight for the baby is 2.7 to 2.8 kg. In India, it is 2.8 kgs, and in South India, it is 2.5 kg, the weight of the baby. Okay, at birth 2.7 to 2.8, India 2.8, South India 2.5. Moving on to the weight gain, the MCQs, we have so many MCQs lined up. The 2 times its weight. So we know that the weight for the baby will be at birth 2.5. By the end of half a year, that is 6 months, 5 to 6 months, it will be 2 times. 1 year, it will be 3 times. Second year, it will be 4 times. And by the end of 3 years, it will be 5 times. So we see that 2 times by 5th and 6th month, 3 times by the end of 1 year, 4 times by the end of 2 years, 5 times by the end of 3 years. This has not appeared. These 3 things have come in the previous papers. Next, the low weight for age is nothing but the acute and chronic malnutrition is common in both weight for age. We have studied weight for age. In weight for age, both acute as well as chronic malnutrition occurs. Okay. We see low weight for the age indicates both acute and chronic malnutrition. Moving on to height for age, the height gain. We have 2 MCQs. We know at birth the height will be 50 centimeters. The length of the baby will be 50 centimeters. And it will reach 2 times. It will reach 2 times at the end of 4 years. And it will be 3 times the height at the end of 12 years. 4 years, it will be twice its height. By the end of 12 years, 3 times its height. Okay. 100 centimeters by 4 years, 150 centimeters by 12 years. In the 4th year, it will be 2 times its height, and by the end of 12 years, it will be 3 times its height. Next, we have the other MCQs, that is the best parameter for the assessment of chronic malnutrition. What is the best parameter? We know when C comes, we have AGE. Okay, so that is the height for age in cases of chronic malnutrition, and the best indicator for long-term nutritional assessment is also the height for age. Okay, height for age or length for age is for chronic malnutrition and long-term assessment. Then moving on for the weight for height. The weight for height, when there is low weight for height, it indicates the nutritional wasting or emaciation. Wasting, when there is wasting, we have low weight. Okay, wasting is low weight. When there is stunting, it indicates low height. So we know this. Next, we have the other MCQ. At birth, the head circumference is more than the chest circumference. At birth, we know that the at birth 34 centimeter will be the head circumference and the chest circumference will be 32. And at the completion of 1 year, the head circumference will be equal to the chest circumference. So these were the 2 MCQs which appeared. Next, we have the ratios. We don't have an MCQ in this. That's all. So this were the MCQs which were found in previous papers. Thank you. With this, we come to an end of growth and development. In the next video, we'll study about the milestones. That is the behavioral development, which is assessed in 4 fields: gross motor development, fine motor development, language development, and social development.